dense MCA sign and an acute infarct. Okay? Fine. Left acute infarct with a dense MCA sign. Yes. Yes. Can you identify the abnormal area here? Right side or left side? Right side now. Yes. See, it looks like an infarct. So there is diffuse hypodensity, grey as well as white matter. But what is this? This is bright appearing area. If I take a measurement pointer and I put it over here, say it is giving me a value of plus 50 HU, 50. What is this? Plus 50 HU is acute blood. So whether this is a intracranial hemorrhage primarily or an infarct, let us consider both possibilities. What are the characteristics of an infarct? An infarct should conform to a vascular territory. Right? This is conforming to a vascular territory. This is right middle cerebral artery territory. See, this parenchyma is paired here. PCA is paired. This ACA is paired. MCA. Plus, if this was a bleed, is it possible that this could be edema? This hypodense area could also be edema surrounding the bleed. But is it possible that the bleed is so small and the edema is so large? No. Right? There should be a rim of edema around the bleed there. So it doesn't match. So what is this? This is an acute right MCA territory infarct with secondary hemorrhage within it. This is a differential diagnosis. So it is sometimes not so easy, whether to diagnose it as an infarct or a bleed. You have to think of other findings as well. So firstly, it is conforming to a vascular territory, so it is most likely to be an infarct. But have you heard of reperfusion injury? You must have read in Harrison. If you reperfuse the artery later on, what happens is there is secondary hemorrhage within the infarct that occurs. So this is acute right MCA territory infarct with secondary hemorrhage within it. Okay, fine. Now look at this. Can this be a hemorrhagic infarct? The answer is maybe, but then the infarct size should be larger than the bleed. Here you can see that there is a bright appearing lesion. If I put a measurement pointer over here, the value that I get is around plus 40 to 60 HU, which tells me this is acute blood. And can you see there is a very small rim of edema around it? Right? So this is primary or intracranial hemorrhage with surrounding edema. This is what is called as a hypertensive bleed. Acute right basal ganglia bleed. Right? Hypertensive bleed with surrounding edema. See, why am I saying this is a hypertensive bleed? Have I given you a history of hypertension in this patient? The answer is no. See, the site of this bleed is so characteristic that any bleed that you see in the region of basal ganglia is hypertensive bleed unless proven otherwise. What is basal ganglia? See, this central portion of the brain parenchyma, where you have the thalami on either sides, you have the caudate nucleus, you have the lentiform nucleus, which consists of medial globus pallidus and lateral putamen. You have the internal capsule, is called as the basal ganglia area. What is the commonest site of hypertensive bleed? It is putamen. Remember, first commonest site of hypertensive bleed is putamen. Second is pons. Third is thalamus. So if you see this ranking 1, 2 and 3, structure 1, putamen, structure 3, thalamus, both of them lie in visual impression. Now we have seen 3 slides. See how acute blood is appearing. See what is the density of acute blood, right? In all 3 images, try to form a visual impression. This is the density of acute blood, right? So this is again left-sided intracerebral hemorrhage, right? What is the additional finding? Additional finding is that there has been intraventricular extension which carries a poorer prognosis. Right, so this blood has ruptured into the choroid plexus as well, right, into the ventricles, which carries a poorer prognosis. Fine. So this is where the intracranial hemorrhage is with the surrounding rim of edema around it. Okay, fine. Now we come to another important condition, and that is head injury. See, this is another condition.